We would like to welcome you back to your workplace. Over the last months, our schools, our centres and our offices have been closed to students and the public. It has been a challenging time for everyone. We want to express our gratitude to each and everyone for supporting our work, whether you did this remotely or in one of our schools, centres or in one of our offices. We have worked together, stayed connected and we have supported each other. We are now preparing for the reopening of our services in line with the government roadmap. As an organisation, we are committed to the implementation of this plan in collaboration with our staff. As part of the Information and Training programme, we in Waterford and Wexford Education and Training Board have developed an online induction and training programme for staff. It will provide you with the information you need before you return to the workplace. We have a duty of care to look after our own health and safety and that of our colleagues, and to prevent the spread of COVID-19. We ask each one of you to help us do this to return to the workplace safely. COVID-19 Response Plan, Phase 1. Introduction to the Waterford and Wexford ETB COVID-19 Response Plan. Waterford and Wexford ETB COVID-19 Response Plan has been developed in line with the Government's and HSE guidance document, COVID-19 Specific National Protocol for Employers and Workers, the aim of which is to facilitate the return to work of all employees in a manner that is safe and reduces the risk of spread of COVID-19. The following presentation, comprising 3 sections, will guide you through Waterford and Wexford ETB's COVID-19 Response Plan and explain each section in detail as part of your return to the workplace induction. Requirement to complete the Waterford and Wexford COVID-19 Response Plan and Induction. Each of the 3 sections of this presentation directly relate to corresponding sections in the Waterford and Wexford ETB COVID-19 Response Plan. As part of your return to the workplace induction, you must complete each of the 3 sections of this presentation. Each section can be completed at a time that is suitable to you. Once you have completed all sections, we will be asking staff to show that they have understood the content of the presentation by completing an acknowledgement form. Please ensure this is completed prior to your return to work. Waterford and Wexford ETB Statement of Intent. Our COVID-19 Statement of Intent, which has been signed by our Chief Executive Kevin Lewis, is available for you to read in detail on page 3 of our COVID-19 Response Plan. Waterford and Wexford ETB is committed to providing a safe and healthy workplace for all of our employees, as well as persons that may be required to visit our work locations. To ensure this, we have developed our COVID-19 Response Plan, as will be explained to you throughout this presentation. All managers, supervisors and employees are responsible for the implementation of this plan, as our combined efforts will help contain the spread of the virus. All employees will be consulted on an ongoing basis, and feedback is encouraged on any concerns, issues or suggestions you may have. Feedback can be given via your worker representative at each work location or through the manager at each work location. We acknowledge that this is a highly unusual and challenging time for our employees and want to thank you for your continued support and hard work in complying with the evolving health and safety restrictions that have been necessary for us to put in place to reduce the risk of spread of COVID-19 and allow us to reopen our work locations. Phased return to the workplace of employees. Phase 1 of our COVID-19 response plan has been developed to facilitate the return to the workplace of our administration personnel, cleaners, caretakers and any other ancillary personnel in line with government protocol. Our phased return will continue throughout August for all administrative and ancillary personnel. Your manager will consult with you regarding your return to the workplace and agree return dates. The Department of Education and Skills is preparing a separate induction presentation for schools as well as specific guidance and advice to safely facilitate the return of our teachers and students to our schools and centres for the academic year of 2021. This will commence mid to late August 2020. Your manager will provide you with a completed work location information table, the template of which is set out in section 2.1 of the COVID-19 response plan, page 4. The table will include the name of the lead worker representative in your work area. For further information regarding the role of the lead worker representative, please refer to section 3, Responsibilities of persons performing tasks in your response plan. Responsibilities for persons performing COVID-19 tasks. There are 2 main roles assigned to personnel in each work location in order to fully implement our COVID-19 response plan in line with government protocol. These roles are the COVID coordinator, and lead worker representative. The COVID coordinator is the manager responsible at each work location. They are responsible for ensuring that COVID-19 precautions and procedures are fully implemented at the work location, that all employees have completed their return to the workplace induction, that systems and procedures are in place to ensure consultation with employees, and that the COVID-19 response plan is being adhered to on an ongoing basis. The government requires that each workplace appoints at least one lead worker representative. The role of the lead worker representative is to help with putting workplace COVID-19 measures in place, to communicate regularly with the COVID coordinator on matters such as the government COVID updates and conveying any COVID concerns from employees, assist in providing COVID-19 advice to co-workers, and carry out regular checks to ensure COVID-19 control measures are in place. Specific lead worker representative training will be provided by Waterford Wexford ETB to all employees who are appointed as lead worker representatives in our work locations. Specific guidance has been prepared by the Health and Safety Authority for the role of the lead worker representative, and the following slide highlights the information they have prepared for all workplaces. In addition to the lead worker representative, designated persons shall be assigned responsibility at each work location for specific tasks related to COVID-19, such as regular cleaning and sanitisation of work area and work surfaces, review of our training needs, for example, COVID-19 inductions, lead worker representative training, cleaner and caretaker training, as well as managing the return to work declaration forms. Managers will consult with persons responsible for these tasks, and prior to the return to the workplace, they will have briefed them on their tasks and responsibilities, as well as entering their name against the relevant tasks in the responsible persons register in section 3.3 of the COVID-19 response plan. Training and information for employees. All employees will be trained in the content of the Waterford and Wexford ETB COVID-19 response plan as part of their return to the workplace induction. A copy of the plan is available on the link below. The plan is a live document and as such will be subject to regular review and update in line with government and public health advice and guidance. Any changes or updates to the plan will immediately be notified to employees by their manager or lead worker representative, as well as via the WWETB website. WWETB work locations have put in place additional health and safety measures with regards to HSE COVID-19 signage and hand sanitising stations, upgraded cleaning and hygiene steps, and made adjustment to the normal operation of business in order to comply with COVID-19 physical distancing and hygiene requirements. Specific changes at your location will be notified to you by your manager or lead worker representative on your return to the workplace. Any new or temporary employee to WWETB over the coming months will be given a specific COVID-19 induction as part of their general health and safety induction on commencement of work. Employee wellbeing and mental health. The COVID-19 pandemic and resulting restrictions that we have had placed on us is a highly unusual and sometimes challenging time for us all. It is more important now more so than ever before that we all look after our well-being and mental health. WWETB have access to a range of supports for employees. Therefore, should you have any personal concerns or queries with regards to COVID-19, such as stress, anxiety, or how returning to work may affect any underlying condition you have, please contact your manager or the WWETB Human Resource Department, whichever you feel most comfortable with, for information and assistance. Should you have any concerns with regards to health and safety and COVID-19 prevention measures at your work location, please let your manager or your lead worker representative know immediately so that the appropriate actions can be taken. WWETB provide an employee assistance and wellbeing programme for all employees, information on which is available to you at the link below. In addition, there are supports and services that are publicly available for use by employers and employees, such as the government's In This Together campaign, which provides information on minding one's mental health, information which is available to you on the link shown. All employees returning to the workplace will be asked to complete a workplace declaration form at least 3 days before coming back into work. Your manager will email you a link to the form that is required to be completed. Following your initial return to the workplace, if you take annual leave, are out on sick leave or take any other type of leave, you will be asked to fill in the workplace declaration form again prior to your return to work. In addition to completing the workplace declaration form on your initial return to your main workplace, if your work role requires you to visit a number of different WWETB locations, you will be asked to fill in a workplace declaration form at the time of entry to each work location you visit. COVID-19 can make any person very ill. However, for some people with underlying health conditions, the risk may be higher. There are 2 levels of risk as categorised by the HSE. The first is very high risk, the second is high risk. If you have an underlying health condition, please visit the HSE website to determine which level of risk might apply to you, as well as for further information and advice on what you should do. The link is provided below. You are advised to inform your manager privately or the WWETB Human Resource Department, whichever you feel more comfortable with, if you fall into either of the risk categories. WWETB will work with you and in accordance with your doctor's advice in determining your safe return to the workplace plan and timeframe. Contractors and visitors to our work locations will be on appointment only as far as is practical. They will be asked to complete our workplace declaration form prior to entering our work locations. Where a contractor carries out work at a number of different WWETB locations, for example our contract cleaners, they will be required to complete one form for each location they work in. They will only need to fill in the form once for each location unless they are absent from work due to annual leave, sickness or any other type of leave. Then they must fill in the form again upon their return to work. Implementing the COVID-19 response plan. Managers in their role as COVID coordinators have the responsibility of ensuring that this COVID-19 response plan is fully implemented in their work location. To aid in monitoring compliance with the plan, as well as ensuring ongoing consultation with our employees, our COVID coordinators will be supported in each work location by their designated lead worker representative. As the information and advice issued by the government continues to evolve over the coming weeks and months, we may need to make updates to our plans to reflect any such advice. Employees will be briefed in all such updates by their manager or lead worker representative. Information updates will also be posted on the WWETB website. All employees have a duty of care towards themselves, as well as a legal responsibility to comply with all safety precautions and procedures implemented at their work location in order to ensure their own health and safety, that of their co-workers, and to reduce the risk of spread of COVID-19. It is the responsibility of each individual employee to ensure they continue to strictly adhere to HSE guidelines and work in accordance with the WWETB COVID-19 response plan. Symptoms of COVID-19 and action to be taken. Common symptoms include high temperature of 38 degrees Celsius or above, cough, this can be any kind of cough, not just dry, loss or change to your sense of smell or taste, or shortness of breath or breathing difficulties. We ask that all of our employees make themselves aware of the above symptoms and monitor their own well-being. If you are displaying any symptoms, please do not come to work. Self-isolate at home and contact your GP immediately for further advice. In addition, please contact your manager by phone as soon as possible to let them know the reason you are absent from work. If you feel symptoms develop while at work, immediately put on a disposable face mask or a face covering. Avoid contact with other members of staff and avoid touching people, surfaces and objects as far as practical. Contact your manager by phone if necessary to let them know of the situation. If you are feeling well enough to drive yourself home, you will do so without delay. Once home, you will need to self-isolate and contact your GP for further advice. If you do not feel well enough to drive home, your manager or lead worker representative will assist you in making arrangements to get a lift home from a family member or designated taxi service. While waiting for your lift home, you must wait in the designated isolation area for your work location. Your manager or lead worker representative will advise you where this location is. If you become aware that you have come into contact with a person outside of the workplace who is a confirmed case of COVID-19, please take all necessary HSE advice, which is to restrict your movements and immediately contact your GP for further advice. Do not come to work, but please do contact your manager to let them know of your situation. Spread of COVID-19 and best ways to prevent spread. How COVID-19 spreads. COVID-19 virus is spread between people in fluid or droplets scattered from the nose or mouth of an infected person when the person with COVID-19 coughs, sneezes or speaks. The fluid or droplets land on objects and surfaces around the infected person. Other people then unknowingly contaminate their hands by touching these objects or surfaces and then bring the virus into contact with their eyes, nose or mouth by touching them with their contaminated hands. COVID-19 can also spread if droplets from an infected person land directly on the mucous membranes of the eye, nose or mouth of a person standing close to them. Best ways to prevent spread of COVID-19. Practice excellent hand hygiene. Practice good respiratory etiquette. Practice physical and social distancing. Refer to your COVID-19 response plan for detailed information. The following poster guides you through step by step as to how to wash your hands correctly. The following video gives you a demonstration on how to wash your hands correctly.
Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
The following poster gives you detailed information on how to correctly use hand sanitizer. Hand sanitising stations are in place at entry points into WWETB buildings as well as in strategic locations throughout each building. Signage is displayed in clearly visible locations to remind employees of hand hygiene rules. Avoid touching your eyes, mouth or nose. Do not share objects or utensils with others, for example cups, bottles, forks, etc. Use your own pen for signing documents if required. Do not shake hands with others. Use a verbal greeting only. Remember to wash your hands with soap and water or use the alcohol-based hand sanitizer regularly and in particular every time you enter or exit the building, after coughing, sneezing and blowing your nose, before and after preparing food, before and after eating or drinking, before and after having a cigarette or vaping, when hands are dirty, after toilet use, before and after handling stock, for example office supplies, if in contact with someone who is displaying any COVID-19 symptoms. Respiratory hygiene. The following poster gives you detailed information on how to cough and sneeze correctly to ensure good respiratory etiquette. Respiratory hygiene. Tissue shall be provided for your use in the offices and welfare facilities. Bins are provided into all work areas and are emptied daily. Remember, cough or sneeze into the crook of your elbow if a tissue is not quickly available. Cough, sneeze or blow your nose into a tissue and dispose of the tissue into the bin straight after use. Immediately wash your hands with soap and water or use the hand sanitizer. Signage is displayed in clearly visible locations to remind employees of respiratory hygiene. Physical distancing. Physical distancing is recommended to reduce the spread of infection. At present, we are advised by the Government and World Health Organization to keep a distance of 2 metres from others where possible. If not, then at least a minimum distance of 1 metre is to be maintained. To aid in physical distancing practices, a combination of measures have been adopted in individual WWETB locations. Such measures include, but are not limited to, moving of office desks to give a minimum of 2 metres clearance between workstations, including when chairs are pushed back from desks where space allows. Staggering of morning and lunch breaks to limit numbers in the canteen at any one time. Staggering of morning work commencement times to prevent all employees arriving at approximately the same time. One-way entry and exit routes for buildings. employees to keep to either their right or left-hand side in corridors and stairwells. The requirement for your building will be clearly signposted. Limiting the number of personnel that can access the toilet facilities at any one time. Holding staff meetings or training online where possible. In certain work scenarios where physical distancing may not be practical at all times, then alternative protective measures will be put in place, such as physical plexiglass guards and/or the provision of personal protective equipment. Your manager or lead worker representative will inform you of the physical distancing measures as well as any alternative protective measures that have been put in place at your work location. How to deal with a suspected case of COVID-19 in the workplace. Maintaining personal contact logs. For contact tracing purposes, in the event of a suspected case of COVID-19 in the workplace, each workplace is required to maintain a log of people whom their employees come into close contact with while at work. To make this a more practical system and also to take into account of GDPR regulations, we are asking each employee to please keep their own personal contact log as follows. Make a note at the end of each day, either in your diary or on your phone, of the names of personnel that you have come into contact with at a distance of less than 2 metres for more than 15 minutes total in one day while at work. Your personal contact log will remain private to you and will only be requested by your manager in the event that you display symptoms of COVID-19 or are a confirmed case of COVID-19. Suspected case of COVID-19 in the workplace. In the event of a suspected case of COVID-19, the manager at each work location will take the following action. Arrange for appropriate, thorough cleaning of the work areas, including equipment that the person may have used. Talk to the employee over the phone to get their workplace personal contact log in order to facilitate contact tracing. Inform the WWETB Directorate so that the decisions can then be taken as to whether or not other employees need to self-isolate or restrict their movement. Provide advice and assistance if contacted by the HSE. Use of personal protective equipment. Wearing of face masks. Wearing of a face mask is not mandatory while at work. However, there are certain situations where the wearing of a face mask may be required, such as if you have been recommended to do so by your doctor, in specific work situations or for specific work tasks where a minimum of 1 metre physical distance cannot be maintained from others. If it is your own personal preference to wear one and feel more comfortable being in the workplace doing so, or if you use public transport to get to or from work. A stock of face masks will be available at each WWETB location for employee use if required. Your manager or lead worker representative will advise you where to access the personal protective equipment. Alternatively, you may prefer to bring in and wear your own reusable face mask. There are 2 types of face masks: single-use disposable masks or fabric reusable masks. With a single-use disposable mask, you must dispose it into the designated COVID bin after each use. Fabric reusable masks come in various styles. You must wash them on high temperature after each use and leave to air dry. The following poster gives you detailed information on how to correctly wear a face mask, including the do's and don'ts of wearing a face mask. The following short video shows you how to correctly put on and take off your face mask.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
Wearing of face visors. The difference between a face mask and a face visor are: the face mask absorbs droplets when you cough, sneeze, or speak, whereas face visors do not. Face masks are designed to protect others from droplets when you cough, sneeze, or talk. Face visors are designed to protect you as the wearer. They do not necessarily protect others from droplets from when you cough, sneeze, and talk. Face visors are sometimes easier to wear as they allow airflow, it's easier to talk when wearing one, and it allows others to see your face. A stock of face visors will be available at each WWETB location for employee use if required. Your manager or lead worker representative will advise you where to access the personal protective equipment. When wearing a face visor, you will need to sterilise it with an antibacterial wipe each time you take it off. Store it in a sealed bag when not in use. Ensure the visor comes straight down over your face. If the face shield is diagonal to your face, then it is not effective. Wearing of disposable gloves. Routine use of disposable gloves is not a substitute for hand hygiene practices and may expose the wearer and others to risk from contaminated gloves. Washing or use of hand sanitizer on gloved hands is not appropriate. Employees must not wear disposable gloves while at work, unless required for specific work tasks. Specific work tasks include, but are not limited to, the use of cleaning products, handling hazardous substances, and the emptying of waste bins. Remember, personal protective equipment must not be used in place of other preventative measures, such as hand hygiene, respiratory hygiene, and physical distancing. Cleaning and sanitisation. COVID-19 cleaning requirements. Effective cleaning and disinfection of regularly used work equipment and work locations is paramount in reducing the spread of the virus. During this COVID-19 pandemic, additional hours are being allocated to cleaning personnel and contract cleaners at each WWETB location in order to increase cleaning and sanitisation regimes in line with COVID-19 requirements. In addition, every employee in the workplace has a responsibility to maintain their own individual work desk and work area to the highest possible cleanliness standard. Cleaning down of work surfaces and work areas. Cleaning provisions to be maintained by employees are as follows. Employees must sanitise their own workstation at least twice throughout the day, particularly frequently touched items such as your keyboard, mouse, phone, or desk surface. Cleaning equipment is provided. Please sanitise your hands before and after cleaning. Shared office equipment such as photocopiers, printers and shredders should be sanitised by each person prior to and after their use. Sanitising wipes are kept in these areas. Each employee is responsible for sanitising the area of the canteen table and countertops they have used when they are finished their rest breaks, as well as cleaning the surface of any equipment they may have used, for example the kettle, handle or door of the microwave, fridge door handle, toaster or nozzle at the water cooler. Where possible, bring in your own delf and cutlery from home for your personal use and bring it home again each evening. If you do use any communal delf or cutlery, you must wash it straight after use with hot water and dishwashing detergent. Dry up the delf. If a dishwasher is available, stack it into the dishwasher. Ensure the dishwasher is switched on to the highest wash possible each evening to thoroughly clean any utensils inside. Each employee is responsible for operating a clean desk policy. Only keep paperwork that is necessary for the work you are doing that day on the desk. Sanitising wipes, sanitising spray and alcohol gel cleaners are provided in each work location. Should any additional stock be required, please let your manager or lead worker representative know immediately. The manager at each work location will make arrangements to ensure that all hand sanitising units are checked each morning to ensure they are full. All door handles, light switches and other regularly used or touched items are sanitised throughout the day, and that cleaning checklists are completed daily in consultation with the lead worker representative to monitor cleaning practices at each work location and ensure that all areas such as toilets, canteen, general work areas, entry and exit doors are cleaned daily. First aid treatment and emergency response planning. First aid treatment precautions. Prior to a first aid officer or employee providing first aid treatment, they must take the following precautions to ensure COVID-19 prevention measures are adhered to. Wash hands or use an alcohol gel to clean hands before treatment. Remember, do not touch your face with your hands during first aid treatment. Wear a disposable P2 face mask. Wear a full face shield or safety goggles. Wear a disposable apron. Wear disposable gloves. Do not touch a wound with your bare hand. Do not touch any part of a dressing that will come into contact with a wound. Dispose of waste, for example, the wound dressing, disposable gloves, the disposable mask, into a designated waste bag, seal the bag, then place it into a second bag. Again, seal that second bag. Immediately after treatment, wash your hands or use an alcohol gel to clean hands. The personal protective equipment that you are required to wear when giving first aid treatment is readily available in a bag beside your first aid kit. Please note, as COVID-19 infects through contact with mucous membranes, all first aid personnel must wear a P2 mask as well as a face visor or safety goggles during first aid treatment. In the event of CPR being required, compression-based CPR only to be applied, as per the Pre-Hospital Emergency Care Council Advisory Note. Emergency response planning. Managers at each work location are reviewing existing emergency evacuation arrangements to determine what changes, if any, need to be taken at this time. Some changes that may need to be considered include increasing the number of emergency assembly point locations to accommodate physical distancing, particularly in buildings with high staff numbers. Assign employees to a specific emergency point location, as well as informing employees of their new assembly point location and list the locations to assign staff members on canteen notice boards so that employees can remind themselves of the changes. Conduct a test drill to familiarise employees with the changes. Your manager or lead worker representative will inform you of any changes upon your return to the workplace. Travelling to and from work. Using public transport. If you are using public transport to get to or from work, then in line with government guidelines, you are now required to wear a face covering while on the public transport. Remember to thoroughly wash your hands before you leave home and immediately use the hand sanitisers located at our building entry points as soon as you arrive to work in order to thoroughly sanitise your hands. Using private vehicles. If you are using your own car to come to or from work, then it is recommended that you travel alone and do not give a lift to any work colleagues at present. If it is absolutely necessary for two employees to be in the same vehicle, then a face covering must be worn by both employees. In addition, the passenger must sit in the back seat of the vehicle behind the empty front passenger seat. No more than two employees to travel in a work vehicle, and this is only if there is no other option to do so. Sanitise the inside of your vehicle before you get into the car to come to work and again at the end of the day when you get home. Thank you for your time and attention to view this Return to the Workplace induction video. Please complete the form to acknowledge that you understand the content of the induction presentation. We look forward to welcoming you back to the workplace in the near future.